Good day, I'm Dr. Ebony Lambito Alisa Devesa, and now we will discuss another topic about mental health. So it is about non-suicidal self-injury. So I know you are actually familiar with this kind of activities of adolescents, usually adolescents, but there are also adults that considers to have non-suicidal self-injury. So what does it mean if you have NSSI? So that's the term. So NSSI. If you don't actually don't intend to kill yourself, however, you wanted to cause self-injury because usually due to distress, or you want other people to know that you are in physical or emotional distress and you want to feel the pain. So there is actually self-inflicted acts such as cutting, burning, or heating intended to cause moderate physical damage to the body, such as bruising, bleeding, and it occurs 5 or more days over the past year. So the expectation of these people, that's why they engage in self-injurious behavior, is to have these consequences such as relief from negative feelings or thoughts, resolution of an interpersonal problem, or there is actually promotion or creation of positive mood state. So after doing the act, the feeling of those negative or ill feeling disappears, and then yung akala nila na ma-resolve talaga yung problem with the family, boyfriend, girlfriend, or they feel good about it, then that's actually NSSI. And at least one of the following occurs immediately before the act of intentional self-injury. So before nung act na yon, they have the feeling of negative thoughts or feelings, depressed sila, angry, anxious, may tension, and they criticize themselves. Or there is actually disruption with the planned self-injurious behavior, or there is a preoccupation of the planned self-injurious behavior that is hard to control. They have these frequent thoughts of self-injurious behavior even if no action is taken. So they are very preoccupied of hurting themselves, especially if they feel bad about themselves, if may problems sa family or sa relationship. There is actually an exclusion, Yung body piercing or tattooing is excluded, especially if it's enacted in a culture, or common and mild behaviors such as nail biting and scab picking are also excluded. So if they engage in this non-suicidal self-injury or NSSI, may significant distress, or there is this actually cause problems sa social, occupational functioning, or other important areas sa life, So there is actually a self-damaging behavior that cannot be better explained by another mental disorders, or it is required that the self-injurious behavior does not occur only during psychotic episode, if intoxicated, or periods of delirium, if disoriented, okay? So that's it, Anna. So most of our patients, usually if we see patients, those who goes to the outpatient department or the emergency room, those we consider NSSI, or there is a non-suicidal self-injury, is if they actually do self-harm, like cut themselves. Some studies also have other children who actually cause harm to themselves, like intake of medications, which actually medications that are their parents, or they actually burn or abrade themselves, or do something that cause injury to their body, okay? But they don't wanted to die, okay? They don't want to die, but they cause harm to their body. So usually some of the reasons of these children was because they have argument with their parents, or they actually have arguments with their girlfriend, boyfriend, and they do this self-harm or self-injury. Actually, this self-injury is maladaptive. So it's really important for you to know if your child, your brother, your sister is having these maladaptive coping mechanisms, that they do self-harm if they are in distress or they have problems. Usually, the emotions is too overwhelming, that what they do is to cause injury in order for them to feel better. But it is not actually advisable, and this behavior must also be reported, or they must seek help. Okay, if you know someone who is doing this self-harm during the times that they are distressed, they have problems, so it's really better for them to seek consult, because some other people who do self-harm without intent of dying usually have actually caused their own death. Okay, they at times don't intend to do that, but in the end, what they did actually caused them to their own death. Okay, so untimely death. So what are the factors that actually causes this NSSI, or non-suicidal self-injury? There are actually a lot of risk for non-suicidal self-injury, and one of these are the demographic risk factors, such as being female, during your adolescence, and if there is an unemployment, and there is also increased risk if you are living alone or you're single. So with regards to familial risk factors, if there is health problems within the family that causes actually burden in the family, stress, mental stress affecting one or both parents, and there is actually if there is separation or dysfunctional family and conflict within the parent-child relationship. So these are actually risk factors for a person to have NSSI. So mental disorders can also be risk factors, especially if you have anxiety, there is depressive symptoms, if you have the feeling of hopelessness, you have this aggressive behavior, externalizing behavior na abnormalities, cluster B personality disorders. So cluster B includes those who are antisocial, borderline, histrionic, eating disorders, okay, internalizing behavioral abnormalities, and there is affect regulation problems. Risk factors also includes abuse and physical maltreatment in childhood, such as physical neglect and maltreatment, emotional neglect and maltreatment, and also sexual abuse. NSSI and suicidal behavior actually also have past history of doing non-suicidal self-injury. There is past history of suicidal thoughts and attempts. They are actually preoccupied with those self-injurious behavior, okay? So they also experience NSSI in peers. So peer group is influential as well. It's really important for them actually to seek help. Those who are diagnosed with NSSI, or those who are undergoing those distressing events in their life, or distressing emotions, thoughts, negative emotions that lead them actually to hurt themselves by cutting, abrading, like amputation, anything that actually harms their body, okay? So these people actually need to seek help, or they're actually calling for help, okay? So they have to seek consult with a professional, especially psychiatrist, in order for them to be treated. So this is not actually a joke. This incident is happening, and there is actually increasing incident of non-suicidal self-injury, not only in the country but also worldwide. So if you have watched my video about prevention of suicide, I actually explained to that during that time that suicide actually, there is attempt of suicide or there is suicide every 3 seconds according to World Health Organization. So NSSI can be one of the factors of suicide. Okay, so please help us share this information and help us treat those people who are having NSSI. Usually for those who are suicidal, we give, if they have depression, then we give antidepressants. There are actually other mental disorders that can cause non-suicidal self-harm. So treatment will depend on if there is comorbidities with regards to the situation of the person, okay? So we also include the family in the treatment because usually the people who can also help the child to overcome this condition is with a good support system. So those are actually the family members. So I have discussed the risk factors of NSSI and what can actually cause NSSI. So please take note of those and this is actually a serious matter because there is actually an increasing number of these incidents. And these incidents, usually some of them share it in the social media and actually show them to their friends how they do those self-harm, or they have group of friends who initiate those self-harm during their available time. So before COVID, actually, before pandemic, there are actually incidents that there are frats, no? There are group of individuals or group of teenagers who initiate those who wanted to be in the group to do self-harm, to do self-injury before entering the group. So so those frat who actually initiate those self-harm to those aspiring new members is actually it is not actually advisable. It's prohibited, and we don't encourage that kind of peer group that could influence children nowadays. So there are actually also a group of friends who do self-harm, especially those children who have experienced abuse from their family, relatives, or other people, and what they can actually think is the negative way to deal with their problem. So so please take note of those risk factors, and we hope that this information can help those especially who are affected by people who have NSSI, depression, anxiety, and other mental disorders. So please do share, comment any information, and please subscribe to my channel. God bless.